Hello, Professor Kaplan. It's Gina. Hi.
Good evening.
Hello, Professor.
Hello, Gina.
Hi.
How are you today? Or this evening?
Hello, Professor Coughlin. This is Tiffany.
Hi, Tiffany. How's it going?
Good. How are you?
Good. I figured out how to use the APU one. Last time I couldn't figure it out, so I was on my my one from my church actually. But this time I got the APU one. But it means I have to keep an eye and let you in, which is a safer thing, I suppose, to do. But anyway, we have all the time we need. But I can't imagine we're going to take that much time. But so far, Stella, Tiffany, Diane, Dinarath, and Gina are all here, and a couple of you are muted. And I'm ready to roll if you are. I see nobody's brave enough to show their face tonight. There you are, Diane. Hi. Gina, hello. Darkness of Stella. In the car. Are you in the car? And okay. Well, it's nice to see some of you and to know that several. Oh, good. Hi. Okay. Who wants to? I think probably is everybody. I thought what you might want to talk about first or not is everybody more or less settled on their poster, their chronic disease poster? Any big questions about that? You're all good with that?
For the poster, you don't want the reference in the infographic. You want it separate.
I think you'll save yourself some space and keep it prettier by putting the reference separate. We do like the name on it and the class in a, like if you'll see just make it in a little text box in a corner somewhere or wherever you want to, but just go ahead and do the references on a separate page. That's fine. Yeah, and there's several good examples. I was looking again the other day that are, I sent one student an example, but I had a really fabulous example, but something very strange happened with my computer at some point, and it seems to have some things stored in the cloud and some things not. And so I'll look and it'll say I have certain files, but then they won't show up, and I'm just not techie enough to figure out if they're in the cloud and I can't extract them. So it's been a very strange thing, but I did give one student an example, but I didn't think that example was any better than some of what is under that link when you go to the assignment to read about the assignment. Anyway, there's so many different cool things you can do. I mean, I'm totally not creative, and I would, if it was me, I think the main thing is you just need to review the rubric and say what do we want to know here, and try not to try to keep the description of the topic brief. Sometimes people get carried away in the description of the topic, but that's only worth 5 points in this instance, whereas factors related to the presence of the chronic illness or violence in communities and health inequities associated, that is worth 3 times the number of points. So just a very briefest introduction of what the problem is, because what we're really looking at in public health is less the disease itself and more the prevention or mitigation of conditions that can improve it. So I will figure that's taken care of. And then is everybody going along okay with their teaching projects? And from what I can see, people seem to have a pretty good handle on things.
Yes, so far so good now.
Okay. You know, what I have always found disappointing in the teaching projects, and I know they're big projects, but most people have got a partner and some have more than one partner. It's a lot to do, it's a lot to analyze and assess, but one thing I've been teaching the teaching project for years, at probably 6 years with APU. And one of the things is, how do we know that the person learned anything? And you, most of you if not all of you, have gone to some, see, because many of you are freshly out of school, perhaps you haven't had to do CEUs, but are all of you familiar with the idea of a pre-test to say, what do you know now? And the post-test, this is what I learned. This is so commonly
Yes.
done. Yeah, it's so commonly done in nursing CEUs. Now, what we all know is measuring your learning. You go to a class, you take a pre-test, you take the class, you figured out a couple answers you didn't know before. Maybe you do it with CPR even, and it's a very short-term learning. It's not really measuring what we'd like to measure, but in most instances, it's not possible to measure long-term learning. You're not going to gallop back to this group of people that you had next year and see what they learned over the long term. So it doesn't, depending on the group, it doesn't have to be a pre-test, post-test. It can be with small children, returned, it's not uncommon at all for nursing students to do a hand washing project with small kids, because small kids, listen, how many of you have worked at the hand washing station at the Methodist Hospital? I mean, washing hands exactly. and Tiffany, does everybody wash their hands right when they're adults?
No, no. There was a lot of irritable people about that station saying, I don't do this. This is not how I wash my hands. I was like, okay.
This is not how I wash my hands. So this is not even like how to wash. Sure.
Yeah, that's what they said. One nurse actually said, if I wash my hands like this, I'd never get any work done.
Well, I understand what she's saying, but it's just happy birthday Yankee Doodle or 20 seconds really, isn't it? But that is such a telling statement. So that's why with small children, it's so much fun to use Glow Germ. It's actually fun to use with adults too, but they're not very happy. Glow Germ is where you actually come back, you put the Glow Germ on and it lights up with the light to show where you missed. And people are stunned because they thought they did a good job. Well, we can't do that in most learning environments. We certainly don't have the time, and we can't do it with adults. But measuring is how do I know you learned something? And also, I'm always interested, and rarely get it honestly from students, is if you had 3 people, of those 3 people, how many of them learned something? So I don't know if it's because students don't think about it, or because it's the end of your very long, never-ending, accelerated program. You're absolutely done, and it's like, I just want to get this project in. I don't know which it is, but measuring is important, because in a perfect world, we would assess people before we even tried to do the education intervention. In other words, we'd want to know, what do they need to know? And this is an assessment that I hope you're all using, that what do people need to know? But you're guided in this situation by your preceptor, if you're lucky and have a preceptor, or by, maybe by your clinical professor, however it works. But measuring learning helps us see if we actually taught anything, because sometimes maybe somebody only learned one new thing, but if you learned one new thing and it was really important, that's good enough, if it was an important new thing. So there's different ways to do that. And I just wanted to go over that real quick. So
I have a quick question about that. So when you look at the abstracts and the evaluation tools that we're using, the pre and the post test, are you going to be looking at the questions to see if we need to rework them?
I do review the questions, and occasionally, if you have a preceptor, go with what your preceptor says. And I know sometimes with some of the diabetic projects, we'll have quite a few questions, but usually the people you're teaching don't want, they didn't sign up to answer a big long test. It's just for your information, and I hope you teach again. So if you teach again, how do I know that what I taught made a difference, or that they learned something, or do they already know everything I taught them? So a little assessment ahead was just really 3 or 4 or 5 questions, and not difficult questions, but some kind of again, the more educated the audience is, the higher level question you can ask. If it's kindergartners, return demonstration for washing of hands is a good one. If it's, high schoolers and, maybe risk of smoking or something like that, there's different topics. Okay, so I'm assuming that the chip is the big issue right now, and that's what we talked about. Okay, good. I see. All righty. Now I know some different things have came up, and this assignment we've only been doing it. This is only the second year. So with 4 semesters, this is the 5th time. So we've actually, as a team who helped develop the assignment, I would say overall, we've been very pleased with how it's turned out. And it really is the way public health is going in a bigger scale. Like when I first became a nurse, there wasn't some of the public health policies and things in place that there are now. I mean, there was a lot of things that you never really heard about. But with the chip, it does build off the CHA. So I pulled up a CHA and a chip. So if you look and you go, oh, that's the CHA. Yes, the CHA are the first 6 steps. So this is the rubric from the CHA. I mean, you all did it last semester. So you reflect on previous work, you identify engaged stakeholders. And again, in a perfect world, this is what we would do, but we wouldn't do it in an 8-week 479 class. So when we talk about that, these steps are taken right out of all the kind of CHA and CHIP literature. The whole thing is that continuum, like if you've seen the circle, if you haven't, go back and have a look at it, that when you are working on any big project, you want to know who else in the community, which is what you did last semester, who else in the community should care. So take crime. Crime is, it affects low-income communities. It makes the streets dangerous. So the way it affects health is with trauma. It affects health with, injuries if there's, gang fights going on. And it affects safety, which is a public health concern. If you're not safe, you can't go take a walk down to the store and get yourself some groceries. You can't let the children play outside, so then they're not getting exercise, they're not getting vitamin D. So who would be interested in crime? Schools, law enforcement, boys and girls clubs, businesses. Businesses are very interested in crime. So you think outside of the box. You don't, when you think in multidisciplinary teams in a hospital, you're commonly thinking, oh, we've got the physical therapist, the speech therapist, we've got the nurse, we've got the doctor, maybe we have a social worker. But when you take that out of the hospital and into the streets, who on the street would be interested? And then you really do have to think about what your community is, which is what the Windshield survey is about. And then you collect data. And this is a requirement by all the hospitals getting federal money. So you all probably saw a CHA done by another health group, and they have identified. And so you can steal and give credit to all these people. And then at the end, what you really, in a perfect world, is you would set priorities, and that's step 6 on the CHA. And then the CHA becomes the CHIP part of the whole assessment and health improvement plan, which then becomes the part B, which is first, you don't need to put in your whole CHA. If you just pull out, even abstract your CHA. I mean, some people just pop in their whole CHA, but I don't want to read 20 pages when what I'm grading is the last ones. But an abstract from the CHA is perfect. And most people do that in like a page or so. But you really want to come up to document and communicate process and results of, that's step 6. So that's the first thing that's your kind of short version of your CHA. Then 7 is planning implementation strategies. So you picked, at the end of your CHA, you picked some health priorities. Some people maybe picked 1 or 2, but you're really looking and saying, okay, let's say in my community, obesity is the #1 problem. And then along with obesity comes diabetes and mental health. I mean, there's very few low-income communities, to be honest, that don't identify mental health as a pretty big problem. So take the top ones and think about who else, like, and again, I wish everybody had a wonderful preceptor and a wonderful public health setting, and I know that's simply not the truth. So Dinarath, you've got the high school. You know, I know that's been very difficult, but also you've identified adolescent mental health. That's a top problem. It's not just a top problem at that high school, it's a top problem in any community with a lot of adolescents, because adolescents want to socialize. And then they're being told, oh, come on, you know, wear a mask and don't hang out so much because you give everybody COVID. So, you know, the stress on young people is very difficult. So, you know, that's a health need. So you think, you identify your health needs and who can help you, because in a community, there's not just one person. Even in nursing, you want a team. You may have the primary care for a particular patient, but somebody's going to take over at the end of the shift. And also, you know, you have a dietitian commonly. I mean, these days, in the good old days, people went to the hospital and they stayed there a long time. But these days, if you're a little bit well, you're out, right? You don't stay a long time unless you're really, really sick. And the sicker you are, the more you need that collection of teams. Same out in the community. You're identifying some really deep problems. And so you need to get strategies to deal with those problems. So getting back to obesity, maybe one of my strategies is safer places for people to walk that are, you know, isn't it nice if you have what's called a walkable community? If you can walk out of your house and get someplace. How nice if you can walk to school. So there's different strategies right now to implement. They call them school trains or something, where parents will take over on different blocks and help children to walk to school, or walk and roll or something. Walk and roll, I think, where some bicycle, you know, getting kids, not too young of kids, but older kids on bicycles, exercise on your way to school. Isn't that great when we have obesity problems? Having parks that are safe. And you'll see around in California a lot, there's parks that have gym equipment set up. Like I go to a particular camp at a particular park in San Diego County in Oceanside, and they've got a place where you could do sit-ups and, you know, pull up things and you know, I like to go to the gym, and so if I'm out there camping and can't go to the gym, I'll go and I'll fool around with those a little bit, not too much, but you know, people, it's to get people thinking. And so our nation has been going that way for a long time, and it got a big boost with the Affordable Care Act, to be honest. That helped, that funded some of those things on the side that people don't always know about. So that's, you know, getting the strategies, and then the approaches to strategies and implementing them, and then talking about which level of prevention your strategy will address. And probably most of your levels of prevention are going to address beyond the primary level. But you could do a secondary strategy, like when someday we'll be able to be out and about again without masks on. It's to me, one of the things that I've enjoyed as a public health nurse is doing outreach. And don't call it a health fair. You know, I can't remember where we were, and I was with a group of people, and they're like, don't call it a health fair. People don't come. Call it a wellness fair. Call it a, you know, let's go jump on a jumpy. We'll take your blood pressure while your kid jumps on a jumpy. But, you know, try to think of a catchy name and catch people where they already are on days that they're already present in places. So we used to go to a farm right across from a farmer's market in the late morning and hope to catch traffic from the farmer's market coming across to a particular park, where we would hope that people would come and they would get some freebies. And I've had students there teaching sidewalk CPR, if you know what that is, where you know, it's really compressions, and also screening blood pressure, and educating people and talking to people about, you know, hey, if your blood pressure is great, what do you think you do that keeps your blood pressure great? Oh, you don't think you eat healthy? I mean, actually, somebody's like, yeah, I eat all these cheeseburgers. I'm like, well, your blood pressure is good right now, but you keep that up, and, you know, in 10 or 20 years, you might have to, you know, not have such great blood pressure. And you know, if you think about healthy eating and a little bit of exercise and things like that, talk to people, and if their blood pressure is up high, say, did you realize it was up this high? A lot of times people do know. Or else people will say, I don't want you to take my blood pressure because I don't want to know. You say, well, that's not a good idea. So, you know, what kinds of that would be a secondary, because when you're screening, it's secondary prevention. You're not probably going to be doing tertiary prevention, really. I mean, because that's not going to meet one of your high levels. So, and then the next thing is identifying, under implementing strategies, identifying who's going to make sure these things happen. So what a lot of students do when they do their little CHA outline, here's this kind of little template that I know you can't really see, but they would say, well, the strategy that we're looking at is this. The next steps are Bonnie is going to contact the school and see if they have a wellness coordinator, because some schools do. And so the lead is Bonnie, and the timeline is she's going to contact the school by XYZ time or things like that. So that's you know, it's really the reason the outline was put in is it's way too easy to put it off. Say, oh, I'll think about the chip later. I'm going to finish this first. So by putting out the outline idea, we're just saying, just tell us a little bit about what you're thinking about, because that way you're going to have to think about it. Gina?
I'm sorry to interrupt. I just wanted to ask, because I know you're going over the rubric in the syllabus. I think there's a bit of a confusion because the chip sample that you sent us is actually a CHA and a wind chilled survey. So
Oh, really?
that was a bit of the confusion because like as on the strategy, that didn't have that in the sample.
I'll go back. I thought it was the whole chip paper, so I might have sent you the wrong one.
Yeah.
Okay.
Yeah, that's
No,
what I was
I mean,
saying. That's what I was saying. Yeah, when I
Yeah.
sent you the message, that's what I was trying to
Okay.
say. Yeah.
Gotcha.
Yeah, so I think that was the
Okay.
confusion because the one that we got as a sample did not have what the syllabus was asking.
Okay, well, that's, you know, I know Tiffany said something to me and I'm like, well, read the thing. So, okay, I will go back and have a look again. I thought that was the whole, I thought it was a chip, but I will look again and see if I perhaps converted the wrong doc. Okay. Oh, Gina, you're muted yourself again.
Oh, sorry, one more. Just to clarify from a previous conversation that we had, that you want at least a minimum of 3 of the priorities, is that correct?
Yeah, I'd like
Okay.
to see 3 priorities, yeah.
Okay, thank you.
Cause see, this is what we see. I don't know if you can see my computer, but this is what we see when we look at the sample.
Okay.
It's just
I'll go through it.
that's like.
Yeah.
Yeah, because that's how when I was reading, I was reading the paper and I was trying to figure out which part was a chip. I was like, when does the chip come in? Like I was like, I feel like I'm reading the windshield survey and the CHA. So I was like, I don't know.
Okay, because I mean that is, of course, that is the first part of the chip.
Part
So
of it,
that's
yeah.
what okay. I'll go back and have a look at that. I will do that.
And then for the outline part that you were talking about, do we use that actual format, like that template?
It's fine. You know, I'm really not picky about the outline. The whole idea, and when we did these, when we revised this whole curriculum a couple of years ago, this was what one of the other instructors wanted. And I said, you know what, that sounds like a good idea because it gets you thinking ahead and looking ahead. So you're not at week 7 trying to do the whole thing.
And then when you and then
Gina?
No, Tiffany's still asking something.
I was just gonna say on the outline part where it says like lead and the primary contact. Are you saying like the lead is like, I would say like the lead on this would be me and then the primary contact would be who I'm speaking to?
Yeah, and you know what, if you want to say the lead would be the local primary school nurse, or the lead would be the police, chief of police. You know, whatever your topic is, in your perfect world, when a health industry really does this, when say Children's Hospital of Los Angeles was going to do such a thing, they would be out in the community. They would have advisory boards. So in your perfect world, you say, you know what? I think the chief of police should be here. So So he's gonna, or his designee is gonna take this part on crime
Okay.
to make the streets safer. So, you know, just be big in your thinking. Because we know that, I mean, you know, if you were like beginning nursing students in a perfect world, you know, I know Dean Lesh wants this to go down to the other programs, it's not there yet. I would think that we would be starting something like this, and you'd be running it for a year or two, you know, 1 to 2 years. But we're just giving you this public health view of things. This is what's really done, and it could be, I mean, if you're in a big hospital system, they're doing it. They have to, they're required to, if they want to get, the way you get, the federal government gets people to do things they want them to do is they say, do you want money? Yeah, okay, you will do this. So, okay, we'll do this. But it hopefully makes it better, because I think, you know, you're far enough along in your public health courses now, you can see that primary prevention is how to treat people first. If we can stop it from happening, we're just ahead. And it just takes a long time for that to catch up with the rest of the establishment, because we have the people with the, you know, the social determinants of health that you see, where people live in long-term chronic poverty, you know, have a poor diet, have little exercise opportunity, low education, and at very young ages, they have high blood pressure and diabetes. And if you're starting out at 20 or 30 and you've already got those kind of problems, you know, just, it's so much easier if you could start back when you're a kid and be eating healthy. And don't get me going on school lunches that we're supposed to get all this money to make them healthier. And if you've seen a school lunch, they did not achieve it. They still offer, they'll offer the healthy things but they don't take away the junk food. So what do the kids go for? Yeah, okay. Dinner at or still?
Yeah, I have a question. For the timeline, is the date or the, well, when the goal is gonna be accomplished?
You know what? You do not have to set it within your semester. That's just silly. So I've had some students put realistic timelines, and I appreciate it. It shows that you're really thinking. Like if you say realistically, this is going to need 18 months or 12 months or 2 years, that's fine, because I would say that most of these programs that are actually operational and they come back and they check up and see if they're meeting their goals, it's very commonly a 5-year timeline. So, you know, think in your head, what actually makes sense? Because you're trying to make really, what you want to do is make a small but significant change. And for instance, what, 8, 10, 12, 16, however many years ago, when poor Michelle Obama got in trouble with the Coca-Cola company because she said, oh, I was at the pediatrician, and she's trying to help educate people. I was at the pediatrician and he said, oh, you know, you girls should drink more water and less soda. And she's like, okay, I'll give them more water. Well, the soda companies got after her because of course they all give money to the political campaigns, right? But she was right. So if you can, some of the programs that I've been involved with would give little grants to work with people who get food stamps, for instance, and try to educate them and say, let's talk a little bit about what you eat. Do you think there's even one thing you could change? Like if there's many people who drink soda every day, which has how many empty calories of sugar in it? Is it like 240 calories or something in an average soda? I mean, it's pretty high. So you drink a couple of sodas a day, and you know, and of course diet sodas aren't so good either. What could you drink instead? Can you, you know, would you be willing to cut that soda out and drink flavored water, you know, for a couple of months and see how you feel? See if it, you know, see if it makes any difference, if you lose a little weight or whatever. And I mean, honestly, for some people, you make a little change. So how about for the next week, you walk just for 5 minutes outside, just 5 minutes. Because if you never walk outside, 5 minutes is 5 minutes. And then the next week, what if you made it 10 minutes? And then next week, you know, you say if you do something for 30 days, it becomes a habit. Or, you know, in other words, are there some small steps? Because if you go out and try to change the world with 50 things that I'm going to do right now that are different, how many of them do you think you'll get done? It overwhelms people. So you try with little steps.
I have another question. And for the strategies, do you want us to cite the strategies or can we make our own strategies?
Oh, I would like you to make your own strategies. Absolutely. I would like original thinking. Really appreciate original thinking. And then back it up, you know, with whatever. But no, I've very commonly had students pick, maybe they had statistics and stuff, and they were looking at what a particular child of their area did, and they picked something different because they felt that that's what the most recent statistics, maybe from LA County, or, you know, comparing it to healthy people and things like that. They said, no, this is actually what, you know, we want to do. And one thing is, when you're working in a community, you will not, if you want people to change, leadership has to come from within the community. For instance, in San Diego County, in the African American churches, they identify that the pastor is very listened to. And so when they still do HIV outreach, because in that community, there's a lot of not wanting to recognize HIV or that somebody could have it, or there's, you know, it's a less accepting community for homosexuality. So if they wanted to try to promote testing, because every year they have a get yourself tested thing where they're trying to encourage everybody, you know, to go and get tested to see if they might have HIV. They would go to the Black churches and try to promote and then test right there at the church. And I can remember one time I went to a particular flu vaccine. And again, in certain communities, you know, so the pastor stepped right, he said, I'm going to be the first one to get the flu shot, because of the appreciation of the fact that certain communities are underserved with flu vaccines because of mistrust. So, you know, you say, who else can lead? Maybe there's a coach who's real popular at a high school or things like that. So you try to say, who's a person we can get on our side who people listen to? Because they're not going to listen to you. As long as you're an outsider, they're not going to listen to you. You have to develop relationship and identify spokespersons who support your view and are popular, so to speak, or have some kind of credibility. Gina?
I have a question.
Sure.
Hi. So I know earlier you mentioned in a perfect world, we would be collaborating with the chief of police and school nurses and all that. That's also included in our outline, the template.
Sure.
For this paper, are we actually reaching out to these people and collaborating with them?
You don't have the time to do that. But just think, if my project, if I felt I could improve health, and the reason I picked crime is some years ago I was involved in a very big project in San Diego County, and I was only, you know, a representative of the health department on some ideas for health, and the community was interviewed and 1,700 responses came in. And what it was the California Endowment. What the California Endowment expected to hear was that people didn't have enough access to health care. What they heard was people didn't feel safe. So they said, actually, they were surprised, and they said safety was the number one. It's a health threat. If you can't let your kids out on the street, even if you can go to the doctor, but you can't walk down that street. I mean, in the community or the section of San Diego that I had, it was what color bandana you wore and what gangs, and sometimes you had to go, you know, a couple miles out of your way to go someplace because that was the wrong gang. So these are real things that if you've never been exposed to it, you don't even know it goes on. But these are real problems. And so they said, that they wanted them to say was, we want more clinics, we want more clinic hours, we want more of this, more of that. Like, no, we just want to be safe. When we're safe, then we can kind of think about, and so it's really the hierarchy of needs, isn't it? First, you have to have safety, food, and water. Then you can start moving your way up and thinking about other things. So you can't think about prevention if all you can think about is, you can't think about other health preventions if all you can think about is safety. If you're always have your adrenaline pumping from fear.
So for this project then, if you say we don't have enough time in the next few weeks to collaborate with those organizations, are we going to their websites and getting their reports?
Yes,
Or are
yes. Excellent.
Okay.
Excellent. Yep. Because you may find that they already, for instance, take the police. They have a police activity league that reaches out to children in San Diego. It's called PALS, and they take them on little fishing trips. So they're already interested in improving relationships with kids. If it's you want obesity and you're looking at ways to be more well, the parks already have some programs. So you can say, oh, we're going to partner with this park in our community to increase the number of yoga classes, so we can help people learn how to be more calm and fit and lower their blood pressure and things like that. Yeah, excellent.
Sounds good. And I haven't really looked into the details yet, but sorry, I'm out of breath. If we're unable to find articles from those organizations, can we write it in
Yes.
from the
Mhm.
point of view where it's like they should be doing this?
Yes, you could say we're going to be asking for representation from XYZ to see if they would consider doing this.
Okay.
This is where we just want you to think big and understand how communities work as best as you can.
Okay, sounds good. Thank you for the clarification.
And bring in any personal experiences any of your partners are having. Diane?
Yes, because of the COVID restrictions, when I did my child assessment, I tried to go to the police station in Covina, but they don't allow anyone to go in. So they just use the intercom with me.
Yeah.
So I just looked up my information online. Can I just plug in whatever I get on this?
Yes. Yeah. In a
Sorry.
non-COVID world, I would encourage you to walk in and find out. But we have to deal with our reality.
Even now, like there's like a little community, it's called East Valley Community Center. Like they don't even allow us to like ask questions about. So I'll just get information from their website.
Yeah, it really makes me sad because I would love all my students to be out walking the streets and getting the feel of what it's like. But this is just our reality. But at least you're learning things. And I hope one of the things you're all learning is how you have an opportunity to have input into your community where you live. You have an opportunity to attend a meeting or, be involved in a school, things like that, and policies.
And then for the articles that we're supposed to review, is that in regards to like, say like we want to talk about obesity, we're looking at articles on obesity? Like, is that what you mean?
If obesity is what you've decided is one of your top problems.
Yes, I mean like if you pick that,
Yeah, sure.
Okay.
Yeah. See if the local news or anybody has anything to say about it. A lot of times, actually, less and less is newspapers, but see what you can find out that's happening in your community.
So the peer-reviewed articles, like those are things that are based in the city that you're.
Well,
okay.
no, I'm sorry. For peer-reviewed ones, you may find that there's a program in, for instance, I'm going to pick something again with STD because when you're in public health, a lot of it's STD. And there was a program in one of the southern states, I think, where you could text back and forth. It was a texting program for young people because, of course, there's been such an increase of chlamydia in girls like 13 or 14 to 21 or something. And so they're really trying to say, how can we reach these young people about this? And then also, how people can self-test themselves these days and, send it into the public health lab and things like that. Or a text for baby, that's a program that, you can sign up for, and at least last I knew, and then they would send you a little cheery text every week to tell you, what was happening with your pregnancy and what should be happening and to try to improve pregnancy outcomes. So yeah, those will be an evidence-based studies that you can maybe apply to your situation. Like Greenville, North Carolina had this walking program, and You know, I was in Dubai last year, and the whole city, like one of the princes, you know, it's just the Mideast is like a whole different world. And one of the princes had this deal where every year he was getting out and trying to get everybody to walk more and do some things like that in the whole city. So sometimes cities have get healthy, you know. Well, San Diego County has a big wellness program. I'm sure LA does too, but I'm from San Diego originally, and that's where I did my public health. So Live Well, it's called Live Well San Diego.
So when we're looking at the peer-reviewed articles in the scholarly journals, we're focusing mainly on what kind of things would prevent those problems that we saw in the community.
Yeah, or any you'll find that with whatever your number 1 or 2 or 3 problem is, there may very well be a program that's already been tried someplace that they're saying we've had some success with this. So that might be something to say, oh, I read about this program. Could we try it in my community and analyze it and see if that's a possibility?
Okay.
Yeah.
Professor Koppel, I have a question regarding the CHIP outline for week 4 that's due on the 22. Because we have like a CHIP exercise that we did on the city that we live in or where you were born.
Yes.
So with that CHIP exercise, is that the same template that we're using for the CHIP outline?
This one should be on what, do all of you have a partner from your CHA that you're working with? A partner or two, yeah. It should be the community you did your CHA on, because that's what you're going to do your CHIP on. I mean, I'm suggesting, and my expectation is that people will do their CHIP branching right off their CHA.
Yeah, no, what I meant was because the CHIP exercise, it was like the problem and then the goal. And
yes, yeah, that's fine.
So you want it the same way?
Yeah, you know what,
Okay.
and I'm pretty, like I said earlier, I'm pretty easy on that. I just want I want it to stir up your thinking so that you're not waiting to the last minute. That's really the goal of this. So I don't have like some big hard, you know, must look like this. I just want everybody to be thinking about it, because it's not a last minute assignment where on Friday night you're gonna do all kinds of research and come up with these great ideas. It's, you know, when you start thinking about things, even as you go along in your regular, at your job, or when you're driving around, you might go, oh, that's a thought. Or you might even see something on the street, or you might see something in a park. You're like, oh, that's a good idea. So I want you to, you know, it's so easy to just be so directed to one particular area that your brain doesn't have time to be like creative and thinking. But outside of the box, trying new things and thinking about the community. What's the community like? What would they like? Who are their leaders? And what kinds of, again, if the community isn't behind the intervention, you can make all the interventions you want, but if it doesn't make sense to the community, it's not going to work. Okay. I will definitely see what happened. I thought I had a whole
one more,
paper.
Professor.
Oh, okay.
Hang on, one more.
I'm here.
On the Pender's health promotion theory, just wanted to let you know that, you know, the link for week 4, the Pender's health promotion theory, the video in that link is not.
Okay.
Yeah, it doesn't work.
Yeah.
I try to use it too.
Yeah. I thought it was just me, so I just wanted to make sure.
Pender's health theory.
Yeah, there's a
Yeah,
video.
so the video is not
link.
available.
Yeah, it says video unavailable.
Okay. Okay, let me look into that. All righty. And which week did you say it's under?
Week 4, I think. Yeah.
Week 4 and the link. Yeah. Okay, I'll have a look. Sometimes they take the videos down, and sometimes what I do for the online class is the IT people say they prefer that they send the whole thing over to me. I don't build it myself. I mean, you know, when you build these courses, you got to take this and do that and fill on all these pieces in, but they worry that with there's so many links that you guys have to use that they ship it over, and every once in a while a link becomes inactive, or every once in a while a file becomes unavailable. And, you know, I test out most of them, but I can't test out all of them. Like, I know they don't want, I know the university doesn't want to pay me that much time to test every single last little link. And I don't work for free all the time. Yeah. Okay. So I'll check that and I'll check the chip. Anything else?
Just one more question, just about the
Sure.
forensic, the thing where we're doing with the nurse rules.
Uh-huh.
You know how you have the little different discussion boards, and you said if we find something to add it to other boards, like is that something that we have to always do?
No.
Okay, because I'm
You know,
like,
but again, I'm not the one who built this course. Somebody else built this course. And
Okay.
I think very few people have ever used those. You know what? I think the instructor wanted to add it in, the one that built this particular course, because she thought, well, maybe people would like to do ideas. But the thing is, I make this a group assignment unless people don't want it to be group. Is that somebody, Diane, is that your kid?
Yes,
your
my daughter.
your cute daughter. Hi, how are you? Oh, how old are you?
8.
8. I was thinking 8. I have like a 7-year-old grandson. Yeah. No, so you know what? If something helps, use it. If it doesn't help, forget it. Yeah.
okay,
Okay. All righty.
thank you,
Okay. Well, have a good week, everybody.
thank you,
Okay. Bye-bye.
Thank you.
bye.
Thanks for
Bye.
coming
Thank you,
up.
Professor. Bye.
You're welcome. Bye-bye. Bye-bye.